Welcome back to movementprofessional.com. So today we're going to take a look at the 4 Ds of pressure therapy, and we're going to use the supine overhead activity with the pinky ball. In this case, you can also use a tune-up fitness yoga tune-up ball. We're going to use it in the thoracic spine between the shoulder blade and the upper back. So we could also think of that as the dorsal rostral area or the posterior aspect of the rib cage. So if we're thinking about where we want to put this, you have an area that's the shoulder blade. You could usually reach back and feel like the border of that, and then you have the area that's your spine. We want to have the ball between the alleyway there. All right, so before we even put the ball down, we want to get to the idea of where we want to be without the ball. So if we're lying down, we want to be on our back. We want to feel the back of the waistband lightly touch the ground. So normally you have to do a little bit of a pelvic tilt to get there. And then we want to feel the back of the head and then the space between the shoulder blades on the ground. So the movement we're going to do without the ball there, and then eventually when we put the ball there, is a reach up, and then we're going to try to maintain that reach. So we're keeping the space between the shoulder blade and the spine open as we reach up, and then eventually try to turn so the elbow is facing the ceiling and not kicking out. Eventually we're going to get to a point where we're either going to be pressing into the ball or squeezing our shoulder blades together, arching our back, or we're going to have the elbow kick out. So at that point we're just going to stop, and then we're going to breathe there. So our inhale is going to go down into the ground, so the space between the shoulder blades widens and goes into the ground. The exhale is going to bring our ribs down, bring our belly button down. So we're going to try to do that with every breath, be able to reach and get a little bit more overhead with this elbow pointing up towards the ceiling and keeping the shoulder in external rotation. So when we put the ball there, we have now more feedback for what's going on in that space between the shoulder blades. So step one, the first D would be to desensitize to that pressure. So we let the ball sink in, then we're going to put our head on the ground, and we're just going to relax here, because right away the body's going to want to move off of the pressure of the ball. It's going to want to guard and arch away from the pressure of the ball. So we're going to desensitize to it by just hanging out here and breathing, letting the ball sink in, letting our body get heavy. All right, so once we're able to do that and the pressure is able to deepen into our tissue, which is the second D, we then create this little pelvic tilt, and that's going to move our back more into the pressure, ideally. So then we'll add this reach, and the reach up opens up the space between the shoulder blades. And we can do this with both sides because it's helpful so we don't turn to one direction more than the other. And then we're going to take the arm on the right, because that's the side I have the ball on, and I'm going to be reaching, keeping that space open. Tend to do this on an inhale. And then once I get to the point where I feel like I can't go any farther or there's too much discomfort, I'm just going to hang out there and take another breath. I breathe in, breathe out. When you breathe out, your belly pulls in. You feel like you get a little heavier on the pressure. When you breathe in, you actually breathe more air into the lungs, which creates more of a backward movement of the lungs into the pressure of the ball. And then that should give me a little bit of space to reach a little bit more. My next exhale, belly button pulls down, ribs come down, I get heavy. Next inhale, I create more space, and I reach a little bit more. And I see how far I can go before there's some type of compensation, elbow out, or I'm compressing or squeezing into the pressure of the ball. So the first D is to desensitize into it. The second is to allow that ball to sink in and deepen. Then the next D would be to dissociate. So in this case, what we're trying to dissociate is the motion of the arm going overhead, which is shoulder flexion, and also shoulder external rotation. We're trying to dissociate that from squeezing back this way, squeezing our shoulder blades together, or extending our spine. So we want to keep the shoulder blades open for the most part as we are going into this overhead position. And then finally, the last D is just duration. Spend at least 2 minutes exploring that so that you can actually go through all of the stages to allow the exercise to be effective. If you have any questions, you can go to movementprofessional.com. I'll see you next time.